Let's take the discussion further. We're on the line to Alex van der Heever. He's the Chair of Social Security Systems Administration Management Studies, Adjunct Professor in the School of Governance at the University of Witwatersrand. Joins us via Skype. A very good evening to you. Thank you so much for speaking to us. So, lots of considerations on the table, some which the President said will be expanded on when the ministers and their various portfolio outline this. So obviously careful thought has to be given to this. Give us your sense of what should be the criteria, which sectors should be prioritized, and what public policy guidelines should be zeroed in on.
So I think firstly, in terms of priorities, it depends very much on the extent to which a coherent health protocol can be created for a particular sector or a business type. Not every business has the same requirements. And and it's also quite difficult to determine what those, let's say, health protocols would be entirely from a top-down perspective. You require a lot of feedback from businesses themselves on how they can manage their particular situation. So it depends on how workers must be transported to the employer, how their transport is organized, what their workspace is like, and how that can be managed. So I expect that they will go through this last phase now before 1 May in intensive discussions on what those protocols could be with the industries concerned. It has to be in conjunction with them.
Let's just talk about the safety measures. I mean, some industries have argued that by the very nature of the work that they do, they should be considered first because some automatically wear gloves, face masks, etc. But it's about the implementation thereof. If you look at health and safety within the mining industry, for instance, if you speak to the labor unions, it's a completely different matter. And it also does come down to how much you can separate the workforce and employees.
Yeah, so certain sectors like mining, for instance, are absolutely crucial to the South African economy. And they also represent a group of workers that is quite vulnerable to the virus itself. So under those circumstances, a lot of consideration will have to be given to specific requirements that apply only to mining. It's difficult to determine what those would be until one works through it, and the unions would be quite critical in making that decision. But in a lot of other areas, for instance, the work from home requirement, the President indicated that if somebody can work from home, they should. So you're not necessarily bringing everybody back into organizations immediately. Only the people who do need to be on some sort of at some sort of factory floor or in some sort of office. So first of all, separating a lot of people out of the system, and then you're dealing with the residual group.
Let's talk about the geography of the workplace. How amenable or how easy would it be for some rural areas or just geographically for some companies to really meet those demands?
It might not be easy for everyone, but it does depend on their sort of regional risk that they may represent. Remember, there are a lot of other health prevention measures that work together. So the more that work together with what might be employer-specific protocols. So I would expect that many employers would have to cooperate with the health authorities in permitting the testing of their staff. So if there's a higher risk, then you want to have a higher, sort of far more intensive testing program for certain employees. The requirement for people to wear masks. There's risks associated with air conditioning in certain environments where you're working within a sort of a closed atmosphere and space. All of those things would have to be designed. So it is quite difficult to say what everybody would face. I think that the process working from now on is to actually work out how you can open up virtually the entire economy, but still keep everybody safe in doing so. It's going to be a process. It does have to happen relatively fast. But the framework that's been outlined allows for a reversal if something goes wrong. And that reversal can be quite localized. So if you open up a business and it wasn't successful and the businesses aren't compliant, you may pull back, correct, and then reintroduce. So I expect we're going to see that kind of process going forward.
All right. Thank you so much for sharing your thoughts, your insights. Alex van der Heever, Chair of Social Security Systems Administration and Management Studies, Adjunct Professor in the School of Governance at Wits.